You champion the role of parents in education. Now, why is that important?
Yeah, so what we do is make sure that we can give parents a voice in education, and we do that by asking them regularly in terms of a range of surveys around actually what they think about education and actually what's important to them.
And what do you see as the biggest challenges affecting family life at the moment?
So I think in education, what parents are telling us is that the mental health of their children is their number one concern. They're concerned about a whole range of issues, as you'd expect for children. School sort of like is writ large in relation to that. So they're worried about their children's exam anxiety. They're worried about issues of bullying. They're worried about actually the expectation increasingly on young people to be constantly on social media is a major concern for parents. Although what we are also seeing from about 30% of parents, concerns about more serious issues like cutting, like eating disorders. So parents are really worried about their children's mental health, and actually they want schools to actually be part of the solution to that.
Now, your latest Parent Voice report's just been published. Can you tell us about its key findings?
Yeah, so the key findings of that, as I've just said, is that parents really are hugely concerned about the impact of mental health and actually their children's poor mental health in many cases. And I said that's to do with issues that relate to schools, such as exam anxiety, but it's also around the wider context in which young people have to live these days, and the pressures from social media, bullying, issues of sort of sexual abuse or sort of sexual harassment within a school environment. So parents have a huge number of concerns around those issues, and really, the key driver from them in terms of what they're telling us is that they think schools are doing a really good job on a lot of these things, but they think more needs to be done to address the issues. They are very keen that actually mental health and actually support is higher up the curriculum to develop young people who are actually sort of happy, resilient, and actually have good mental health. And for whatever reason, that's not the experience that many young people have at the moment.